otherwise, what we've learned from the smoking problem, there was a lot of education that was done that didn't work. And so millions and billions of dollars were spent by the federal government, and smoking rates amongst teens did reduce dramatically. So we've learned, as a public health community, we've learned from that. We're applying that to almost everything that's being done now. It needs to be evaluated. Before you get funding, you need to be able to show that this does, in fact, reduce disease risk. Again, this is unique because most studies look at height and weight, and then they'll maybe have a community nutrition class, and it's really difficult within a 16-week period to see a difference in weight. And whether or not that's clinically meaningful, does that really mean anything? Are we really reducing disease risk, which is what we want to do? We also, that's our teaching action. We also gave each of the students a $25 gift card to Food for Less, which some of our girls like to buy hairspray and hair ties and whatever else. But that was their compensation for their time. And the goal of our program, there's been a lot of different nutrition models. The food pyramid, all different models. We wanted to test the education of increasing fiber and decreasing sugar. Does that model work for kids? We know that dieting has an adverse effect on youth. So we focused the message very simply on it. So we looked at fruits and vegetables. We had demonstrations about soda consumption, had them measure out the sugar. This was our two main messages. And again, for the first half an hour, they were doing, I don't know if it was really cooking, it was more food prep, making sandwiches, salads, lots of fruits and vegetables, whole grains, replacing soda with like Crystal Light, which I'm not a huge fan of, but it's better than soda. And what we found after the 16 weeks, first of all, interestingly enough, they were randomized to 3 different groups. One was nutrition only, one was nutrition and physical activity, and then there was a control group. We saw no significant difference in any of the physiological parameters between those 3 groups. What we did see, though, is those that followed our dietary compliance, which if any of you want to write this down, our goal was to consume less than 50 grams of sugar or more than 35 grams of fiber. So if you're working with any of your kids, that was kind of a number that we came up with as a healthy way, and for all of us as well. So we did 24-hour diet recalls on them, which is the gold standard right now. We asked them about their food consumption the day before, and we did that throughout the program. Those that decreased their added sugar and increased their dietary fiber, which we call dietary compliers, and also had increased parental attendance, which we found was very important. They improved their insulin secretion, their overall performance of their pancreas, and they reduced their visceral adipose tissue. Anyone know what visceral adipose tissue is? You want to share?
The tissue inside the organs.
And that's important, exactly. It's important because if you were to look at an MRI slice of the abdomen, you could have individuals with 2 very similar waist circumferences, but one that deposits fat around their organs and the other that has more subcutaneous fat. Which one's going to be at higher risk for developing diabetes? Which one?
Around the organs.
Around the organs, exactly. So this was, we did MRI scans, which was, gave us that information. So this is me, very happy in our beautiful study, and this is the girls at the end of our intervention. They all started at least either overweight or obese. And it's disheartening, really, after 16 weeks of sweat and tears and giving them everything, the gold standard, picking them up at their house, reminding them everything we could do. It's still really difficult to change their behavior. And what I found was when I was picking them up and dropping them off, this is what I saw. So this is a shot of South Los Angeles. It's pretty self-explanatory, I think. Our kids live in one of the worst food environments probably in the country. And I think some of you are familiar with South LA. Not all of them are from that area. But it's extremely difficult to take a kid and bring them to the ivory tower. I'm moving away from academia right now, so I hope to not be demonizing it. But to take our kids out of their environment, it's a great idea, nutrition education, and then we put them back in. Even though they have a little bit more resources with the gift card we gave them, they're still confronted with this. And so then I started to look and say, okay, well, how am I going to fit into this problem? Because we could set up a nutrition class on every corner in South LA, or at the City Heights Wellness Center, and have it free, and have it going every hour, on the hour, for weeks, months, years. Is that really going to make an impact in reducing health disparities? And I started to really understand that it wasn't. So I began really looking at the food environment and questioning what role does the food environment play in childhood obesity? We can define the food environment in a lot of different ways. You can look at the home food environment, so what's in the refrigerator, what's on top of the refrigerator. You can look at the school food environment. You can look at, which would be breakfast, lunch, or even the carts or liquor stores around the schools. You can look at the community food environment. So again, are there grocery stores with fresh fruits and vegetables? Are they reasonably priced? Is it good quality? Is there an over-representation of fast food? I know West Oakland is a really interesting example. They have 52 liquor stores in West Oakland, and their last grocery store shut in 2007. So there's a program going on called the People's Grocery, which is a really great initiative if you guys are interested. They've got a video on YouTube. But anyway, food environment. So let's take a little historical look at the food environment. Began to sort of research, what is the history in this country? Why is it that certain areas, the concentrations of Latinos and African Americans don't have grocery stores and have all this junky food? Why is this happening? So back in the day, I think that picture may be from earlier than the 20s, but I took a guess. But there were really mom and pop stores spread across the country. And also, people had vegetable gardens, and they grew their own produce. At the end of World War II, there was a big, and World War I also, there was a massive movement for victory gardens. And so you were considered a patriot if you grew your own food. Hopefully we're coming back around to that right now. In the 1950s, we saw what was called white flight. So in urban core areas like Detroit, Philadelphia, Los Angeles, all around the country, middle class, upper middle class, Caucasian individuals moving out of urban areas as concentrations of lower income individuals are living in those areas. The grocery stores followed them, and they developed this new model. Instead of being a small mom and pop store, there's a very small profit margin in grocery stores, something like 1 or 2%. So by expanding their walls out and having more products, they can make more profit. So we shifted to this new model. And at that same time, of course, processed food, packaged food, fast food, all those things are increasing, and just shifting our whole concept of consuming food and our food environment. So today, this is kind of an anticlimactic picture. There's a lot more dramatic ones out there, but this just gives you an idea of, this is kind of a typical store in a low-income area. It's a liquor store. Maybe they have some fruit and vegetables. Maybe not the best quality. Certainly not a nice, shiny Ralph's I know they have in Westwood. So how does this affect what we eat? This is a picture of a family in Mexico, and it's not, it doesn't exactly go along with what I'm talking historically as we're jumping down the country below us. But look at all the fruits and vegetables that are being consumed. Granted, I mean, Coca-Cola is very well represented in the back there. But still, you see a lot less packaged food than this American family. So this, by the way, is from a series called The Hungry Planet, and this is all the food the family consumed in a whole week. So, yeah, I mean, this is a pretty poor food environment, home food environment, I would say. Any questions or comments at this point? All right, well, I'm going to take a little break and show you this film. It's about 8 minutes, and just to give you an idea, this is a snapshot of Los Angeles. Near that star is where our research center is and where we held our classes. And this area right here is where the young woman in the film, her name is Monnier, that's where she lives. If you do a search for grocery stores, there is nothing that comes right here. No grocery stores. In addition, if you do a search for